C427, Topic 3, Health Informatics. Let's begin by answering the question, what is health informatics? Health informatics is the practice of acquiring, studying, and managing health data and applying medical concepts in conjunction with health information technology systems to help clinicians provide better care. The ultimate goal of health informatics is what we see here. Help clinicians provide better care. As we progress through topic 3, you'll see and gain a better understanding of the tools and the systems and the applications that have been put in place to aid clinicians in being able to provide better care with the ultimate goal of improving outcomes. What is public health informatics? So we talked about what health informatics is, right? It's a combination of tools and software and applications specifically intended for the purposes of improving patient care. But how does health informatics differ? Public health informatics differ. Public health informatics is a field involving a variety of skills and competencies related to the strategic management of IT knowledge, information, and data to support public health programs. Ultimately, the distinction is public health informatics is specifically intended for use with public health programs, whereas health informatics is more so structured for the clinical perspective. Let's make sure we have a clear understanding of what public health is, though. Ultimately, public health is it's a practice. What we do in public health is we conduct scientific research for the purposes of educating individuals and educating the population or educating the public, rather, to help ensure the improvement of conditions, for the intervention and for the purpose of mitigating conditions, and ultimately for the prevention and the eradication of conditions or circumstances. It's not always conditions. Sometimes it is circumstances. For example, homelessness is a public health issue. Okay, so public health informatics is relatively new. But what we're doing, or what you see these public health organizations and agencies doing, is utilizing these specific electronic tools and applications to do exactly what we just said, or to try to fill the space that public health does, to help when we are examining the prevalence of chronic conditions and ensuring we understand how to communicate that prevalence throughout different agencies and into and with healthcare systems for the purposes of the improvement of targeted population health outcomes. Let's look a little bit at how this happens, right? So we have all of this information. We're taking this information in, we're serving patients, serving the public and population. All of the information that we gather at that point is raw data. It's not really in a usable format until we convert that raw data to information. Information is the point at which that data actually becomes usable for the purposes of informing us, knowledge, right? Or for the purposes of helping us make a decision. Okay. Whether we follow the path to the decision from information or the path to garnering additional knowledge, we realize additional knowledge is needed, then we make a decision. Ultimately, that will lead to an action. Once we make the decision, we're going to implement that decision. We're going to implement that practice or that process. And then we do it all over again. It's a cycle, right? But ultimately, we begin with raw data, and that data is not usable until it's converted to information, which is where the informing begins, which is where we actually are able to gain greater insight, okay? How do we apply this? Let's look at an example. Los Angeles County. Their public health utilizes the LACPRS, which is the Participant Reporting System for Substance Abuse Prevention and Control Data, right? This system is available only to this county. So you may have different types of reporting systems within different counties or different regions in the United States, but also to the individual substance abuse service provider facility. So meaning they have a pathway. It's interoperable, right? And that interoperability component means these systems are able to communicate with one another, and the LACPRS can feed that information into the individual substance abuse service providers, right, to report data on specific patients or clients, how they come into and out of the system, the type of services that they are receiving, the reasons for those services, and it allows for comparisons of outcomes across programs and provider locations. This is how we are using that electronic information system or these health information systems for the purposes of reporting and tracking and trending, specifically here with public health. Another example is the San Diego Immunization Registry. This is used to report vaccinations, to share patient immunization information, and identify what immunizations may be required in the future, as well as what you already have. This helps with determining effectiveness of immunization interventions, right? Meaning those specific, focused, and concentrated efforts to get more people to immunize. This is how we're using health information systems in public health, okay? Surveys. The BRFSS is a national survey. NHANES, that's a national survey. And these are validated surveys that offer secondary data sets where many researchers are able to go into and they manipulate that data, right? They convert that data into raw information to gain more knowledge, answer specific research questions, and they may make decisions to put into practices or processes. Many of the decisions that local county and public health officials make are because they study these specific services or surveys in their regions. Okay. The strategic information systems, planning and strategic systems. What this specific system does, it creates a competitive advantage. There are 5 phases in this strategic information system. You begin by prioritizing the information system planning and review process. What is it that we need to do? What is the purpose? What is our goal? Right? From there, you conduct situational analysis. What's currently happening in our community, in our environment, in our healthcare system that we need to change? Okay. From there, we need to figure out what are our options, generate alternative strategies. Okay. Then we formulate and or select the strategy that we feel may be best suited for the situation or the environment. And then we plan how we're going to implement that process. Because we have this structured process, it does not mean it's going to simplify the process, and it does not mean it's going to be easy, but it's necessary for us to engage in these specific and strategic processes in order to remain competitive. Okay? That competitive edge comes with what you're doing is specifically suited to the needs of your organization. This is not a cookie cutter approach. It's not a one size fits all approach. The purpose of this is ensuring that whatever health information system you are integrating or introducing into your healthcare organization suits your organization. It suits the needs of your organization and the culture of your organization. Okay, let's look a little bit at the electronic health care record. Okay. There is a distinction between EHRs and EMRs, the electronic medical record and the electronic healthcare record. Mostly what we hear now is the electronic healthcare record. The primary distinction is that the electronic medical record, it wasn't as seamless as the electronic healthcare record, which provides total history. The electronic medical record is like your chart from a single provider. The electronic healthcare record is your healthcare information from all providers. It's total health. That's the major distinction, okay? How we go about deciding the information to put into these electronic healthcare records and the information shared and storing and communicating as far as the electronic healthcare record is concerned is laid out here when we talk about the data standards. These are the common standards for storage, sharing, and communication of patient data. These are rules, pretty much. They're rules on how we need to input information for storage, how we need to input information for the purposes of sharing, okay, or communicating that patient data. These are the four most common that you will see: the HL7, the Health Level 7, the ICD-10, the LOINC codes, logical observation identifiers, names and codes, and SNOMED, the systematized nomenclature of medicine. Okay, HL7 is an international organization. HL7 is a process, right? But it's also the name of the organization that established the process for health insurance billing purposes and for what is now the standard for sharing clinical patient data between organizations internationally. So this is an international process. The ICD-10 is the most recent update index of clinical diagnosis codes. When you go to the doctor, they determine what's wrong with you. They'll tell you you have influenza, but what they enter for the diagnosis is a code. Okay, so that's common language, meaning if you go to Dr. B from Dr. A, once they look at that diagnosis code, they'll know, okay, this is what they had. Once they send that information to the insurance company, they'll look at that diagnosis code or that billing code, and they'll be able to make the determination, okay, this was the diagnosis. Okay, LOIN codes. Logical observation identifiers, names, and codes. This is specific for laboratory data, right? It provides the request for laboratory testing transmitted through the HL7 messages. So we see the LOIN codes are used in conjunction with the HL7, but the LOIN codes is specific to laboratory data, okay? SNOMED is how we standardize that laboratory data, and it provides the result of laboratory testing. So the LOIN codes is the actual test. The SNOMED is the result of the test. Okay? All right. This is just an example. I wanted to give you a visual of what HL7 messages look like. It looks like to us, a bunch of gibberish, but this is the exchange or the interface of information that the systems, the health information systems, this is what they understand, how they communicate with one another, okay? Let's take a look at the critical success factors when we talk about the strategic information system planning systems. Ensuring the effectiveness of these systems is achieved by ensuring success factors are satisfied and that they are required components available before we engage in that strategic planning process, right? These are things you don't want to put that strategic plan in place and then have to go back and say, oh, we need to make sure that we have all of these factors, all of these success factors, because at that point we failed. But we want to make sure that these are things culturally in place, in existence prior to we engage in that planning process. So examples of critical success factors include ensuring that whatever information system plan you engage in, it suits the organization structure, right? So you'll hear me saying whatever suits that organization. That is so important because if you're establish a plan or a process or even a system that does not align with your culture, is not user-friendly, doesn't promote patient-centered communication, that's a problem, right? The planners need to be realistic and have access to needed resources, for one, so that they can understand what success factors exist within your organization, and then what is the structure or the culture of your organization. Okay? The planners are capable of aligning health IT with organizational strategy, and they can perform situation analysis well. Remember, these are the steps of that systematic information strategic planning that we outlined those 5 steps earlier. They will achieve an agreement and provide assessment measurement to be integrated into the planning process. And they repeat this until it's a refined, well working process. Okay. Some of the critical success factors for health IT implementation, the who, right? Who is going to be using this? What are their characteristics? What are the demographics of that population? Okay. What is that infrastructure? Are there systems already in place? Is this a system that's easy to use? And then the culture, the organizational characteristics. What is the organization structure? What does the operations of the organization look like? What type of hierarchy exists within the organization? Those are all key questions that the critical success factors and the information systems planning process will take into account, okay? When we think of that HMIS implementation strategy, there are multiple components that you want to make sure, or the organization rather, will want to make sure they consider. Here, we're just highlighting a few. We kind of hinted at them in the critical success factors for health IT implementation, but these are just a little more specific. What does the user know, right? These are all going to impact this piece. How effective is this healthcare management information system strategy? Okay. Should the end user be involved? Yes. The answer to that question will always be yes. Okay. How will we know what's important? How will we understand how the information and the systems and the processes need to work and flow if we don't involve the end users? It has been recognized that unless health IT staff, physicians, and nurses are involved in systems planning and ongoing evaluation, health IT success will be short-lived. Okay? Still, critical success factors. So this is an important concept, these critical success factors. We highlighted some of the internal critical success factors, but let's take a look at the external critical success factors, the industry factors, the market factors, and the environmental factors. What's going on in the community? What's going on politically? What's going on socially? Okay. Who are key payers? Who are key stakeholders in this area? Market factor. What's our geography? Not talking about that internal demography that we talked about with the HMIS implementation critical success factors, excuse me. But as far as our location, are we in a rural area? Are we in an urban area? Are we in a suburban area? What is that? And what services are we offering? Are they services that's needed in this area when we talk about service mix? And then industry factors. Are we being competitive? Remember, we said that one of the reasons for the strategic planning system was to ensure that we had the competitive advantage. That's the purpose of being strategic and planning and researching and engaging, so that you can ensure at least, industry factors is a critical success factor. The cost and the quality of what you are providing is competitive, and people want to seek you out for your services as opposed to the hospital 20 miles away. Okay. The PODC model. You will see this on your performance assessment if you have not already completed the performance assessment. Let's break this down. The purpose of the PODC model is for planning. It's a strategic planning model. There are 4 domains to this model: planning, This is where we're starting. This is initiated at the apex of the healthcare organization, the top, your C-suite. They are planning. Your board, they are determining that vision and that mission. What is our direction? Where are we going? What do we want to do? The organizing piece. Examine your organization structure. Can your organization carry this out? And remember, this is all going to be based on what you're doing. So, for example, on your performance assessment, you're using the PODC model for HIPAA training. So, what your planning piece may look like is the what of it. What are you doing? You're engaging in HIPAA training for what purposes? What is the vision? What is the mission of that HIPAA training that you're engaging in? Do you have the personnel? Do you have the resources as far as organizing, to carry out this vision, to carry out this what that you determine here? The directing piece. Do we have the right leadership in place to lead the team to success? How are we delivering this information? How are we determining that we have the right leadership in place? Okay, and controlling. Develop the right performance measures to measure success from teams and individuals. Evaluation. How are we evaluating to make sure that everything we just determined, everything we just put in place is actually effective, is actually working? How are we making that decision? Okay, so this is just a visual of the PDC model. Okay, PODC model, excuse me. We see here many of that strategic information systems planning elements. Remember, we talked about situational analysis, the strategy formulation, the policy development. All of that is a part of the planning. What is the organizational design? What is our infrastructure? Do we have the resources for your paper? Do you have the resources that you need to deliver a HIPAA training in whatever way you say that HIPAA training needs to be delivered? And be sure you talk about how it's going to be delivered. The implementation, how's it happening? How are we putting it into action? How is it being delivered on your paper? And then performance evaluation, the assessment, okay? Information requirements. We want to investigate and prioritize the organization's information needs. To do this, we must identify the types of decisions that must be made within the organization, right? This aligns with with our information systems planning or our strategic planning pieces and any strategic planning model. How are you making the decision? What information do you need to make the decisions? Are these strategic decisions or are they just decisions for the operations of the organization? Okay. Those strategic decisions are the long-term decisions. Those are going to be the most impactful decisions. Operations, day-to-day mechanisms. Okay. And I kind of what I just stated, strategic decisions, long-term, difficult, operational, more short-term, day-to-day decisions, okay? Data stewardship. What is data stewardship? Data stewardship is making sure we have the right data at the right time at the right place, okay? One key priority in data stewardship is the quality of your data. It's difficult to trust information if it's not accurate. And so the key thing you want to make sure is that data is accurate in the organization, okay? That's a priority. Data stewardship. High quality data is more than accurate. Right data, right time at the right place. So right data means accurate. Right time means timeliness of data. It's there when we need it. And at the right place, of course, would be the delivery for the purposes that it needs to serve. So when we talk about high quality data is more than accuracy, this involves controlling access. Who has access? Are they are the appropriate persons authorized? Okay. Managing data updates, timeliness, That's also accuracy. And validating the data. Okay. How do we know that this is correct? How do we know that this is accurate? There are four key components to data stewardship: quality, management, security, and business intelligence. Okay. Data accuracy is dependent on the rules for standardizing, transforming, and mapping new data to existing data. There should be a connection. There should be a connection. If you have legacy software and applications in your organization, those systems should somehow connect. There should be a connection to help ensure the accuracy of that data. Many of the problems begin at the initial data entry. Human error. Was it typed correctly? Was it keyed correctly? Was it scanned in an image that is very clear so we can ensure this information is correct? Okay. And then the HMIS design and structure itself could be a problem. Multiple systems in use at the same time, kind of like the creation of clutter or noise. If you have too much going on, too many operations, too many purposes, then the design and the structure becomes irrelevant. It's not logical. Okay. Just a review, we have talked about the implementation process, but let's just reiterate this. Assess the availability of resources. Assess the data and the data inventory that you have. Third, profile that data in determining the valid values for each attribute. Review the processes and review personnel responsibilities. These are the 5 steps for HMIS implementation process. Okay. Each of these steps feeds one another. That's key. Reinforcement, reiteration. These critical success factors for health IT implementation. What is necessary? These 3 schools, these 3 pockets for implementation success, okay? All right. Pre-implementation preparation, okay? What do you need to do before you implement, okay? What is our thought process? What is it that we're doing, okay? So look at this. The initial conceptualization. The CEO of a long-term care facility may be impressed by another health systems organization's health IT in the same community or regional area, meaning we might need to make some changes, right? Or the board of directors of a health facility may have discussed health IT in their 10-year plan, meaning we need to position ourselves to be able to implement in our 10-year plan. This is pre-implementation preparation. This is where the initial thought could come from. The strategic planning piece, remember we said it's long-term. It's not that day-to-day operational decision, okay? Your health IT must develop your health IT development, must be based on a strategic information plan that's aligned with the mission and the vision of the organization. You can't implement plans and strategies that do not align, that the communication is lacking. If you have a health IT mission and vision that counters your organization's mission and vision, there's a problem. So you want to make sure that that strategic plan for the health information technology piece, as well as the organization, is aligned. And then the feasibility study. Can we sustain this? Is it feasible for us to upkeep a program? Okay. From the pre-implementation piece, when you have those thoughts, you may go into proposal evaluation and selection. What you're doing here is performance comparisons. You're looking at the environment or an environment that is as close to your environment as possible, and you're attempting to establish goals. What could possibly happen? Okay, that's what benchmark testing entails. Okay. Once you engage in pre-implementation, once you engage in the proposal evaluation and selection, it's implemented, then there's that continuous improvement piece, right? These are just examples of the steps that could look, which that could entail rather, for any HIT program or any HIS, Health Information System. Okay. Once it becomes operational, once we get it off the ground, that's when the maintenance kicks in. That's the continuous improvement piece. So you would constantly be examining these things to ensure they are working, or these are the things you would be engaging in rather to ensure that information strategic plan that you've engaged in is working as you intended for it to work, in alignment with the vision and the mission, right? And the goals that you've established are being sustained and met. Okay. This is something that should be done on a regular process. This post-implementation review is the continuous improvement process. This is something that should be done on a regular basis, quarterly, biannually, whatever works for your organization, but it needs to be continuous, whatever is decided, okay? All right. Thank you so much for engaging in our topic 3 cohort. Any questions or concerns, please do not hesitate to reach out to any of the course instructors for the course. Thank you.